Assalamu alaikum doctors. In this video I am discussing a recall communication that comes on Malaysia 2nd day 2024. So recently it come. The communication is talk to mother on child who had type 1 diabetes mellitus and admitted for DKA. Talk on management on the sick days rule. So sick days rule. We can draw this picture. This sick, S for sugar, I for insulin, C for carbs and K for ketones. Okay. So sick, by this easily we can remember. So as usual we are starting with IRCAP. The rules I am telling sick days rule what they do. First of all, monitor the blood sugar frequently. So blood sugar frequently, that is check your blood glucose levels every 2 to 4 hours, even at night. If you are unable to eat, test every 1 to 2 hours. So in sick days they will check blood sugar regularly 2 to 4 hours. If not eating, then 1 to 2 hours. Second, continue taking the diabetes medications. Do not stop taking insulin or oral medications, even if you are not eating. You may need to adjust doses, so consult your healthcare provider. So, first of all, then insulin is never stop. What medication she is taking, either oral or insulin. As our patient is taking insulin, she will not stop. But she maybe if she stop eating, then also take the medications, and she needs to adjust the dose. Then she will talk with the consultant. Then adjust insulin or medications. Illness can increase the blood sugar level, so you may need more insulin. If blood glucose is higher than usual, follow your healthcare provider's advice for adjusting insulin doses. So adjust insulin dose, because we when measure the blood sugar level, if it is more than high, because sometimes infection, illness, stress increase the insulin glucose level, so then she need to talk with the healthcare providers and adjust the dose. Stay hydrated, number 4. So stay hydrated is very important. Drink plenty of sugar free fluid to prevent dehydrations. Aim for 100 ml every hour. If your blood glucose is low or you are at risk of hypo, drink fluids containing sugar like non-diet soft drinks. So stay hydrated, that is she take the sugar free insulin. Take plenty of sugar free fluid to prevent the dehydration. Aim 100 ml in per hour. If your blood sugar is low or you are at risk of hypo, if she thinks hypo, then sugary drink non-diet she can take. Number 5, check for ketones. If your blood sugar is higher than 15 millimole per liter, check for ketones using a blood or urine test. If ketones are present, you may need medical help. So use for ketones. First of all, check the blood sugar level. If it is more than 15 millimole per liter, remember, higher than 15 millimole per liter, check for ketones using a blood or urine test. If ketones are present, you may need medical help. Then eat carbohydrate. Number 6. Eat carbohydrates is that if you are unable to eat solid food, consume carbohydrate containing drinks like soups, fruits, juices, or sugary drink to maintain your blood glucose level. So eat carbohydrate. If you are unable to eat solid food, then consume carbohydrate containing drinks like soups, fruit juices or sugary drinks to maintain your blood glucose level. Then monitor for signs of DKA. What are the features of DKA? We tell them. Diabetic ketoacidosis. Symptoms include nausea, vomiting, abdominal pain, tummy pain, we tell. Fruity smelly breathing and rapid breathing. If this occurs, seek urgent medical attention. So monitor the sign of diabetic ketoacidosis, that is diabetic ketoacidosis. Symptoms include nausea, vomiting, abdominal pain, fruity smelling. Then seek the medical advice immediately. Urgent medical attentions. Number 8, when to seek medical help. If you are vomiting and cannot keep fluid down. So if you are vomiting, if you have difficulty in breathing, if your blood glucose or ketone remain high despite of treatment, if you are unable to, you are unsure about the managing your insulin or medication, so seek the medical advice when vomiting, respiratory distress occur, not taking fluid, blood sugar level is despite taking treatment not come on control that time, unsure how can she maintain the blood glucose level. So this is sick days rule. Sick, that is S for sugar, I for insulin, C for carbs, K for ketone. Just sick mnemonic we keep and easy to remember. Then I will tell the details about the mother, and also of course we are giving the red flag. Then support group, trusted website, leaflets we are giving according to. I just telling the highlight the headlights of sick days rule. First of all, monitor the blood glucose frequently. Number 1, monitor the blood glucose frequently. Number 2, continue taking the diabetes medication. So the medication taken continue. Number 2. Number 3, adjust the insulin and medication. So number 3 is adjust the insulin and medication. Number 4, stay hydrated. Stay hydrated. Number 5, check for ketones. 6 is eat carbohydrates. 7, monitor for signs of diabetic ketoacidosis. And 8, when to seek medical help. So 8, check glucose level, take medication, then adjust the dose. 3, 4, hydrated. 5, check ketone. 6, take carbohydrate containing food. 7, check any features of decay present or not. And 8 is when seek medical advice, the red flags I will give. So this is all about how can the sick days rule of diabetes mellitus type 1. Thank you.